Good afternoon. I am Deepal Shah, Chief External Affairs Officer for Planned Parenthood of Greater New York and Executive Director of the Planned Parenthood of Greater New York Action Fund. It's a pleasure to be with you this afternoon. Obviously, hoped for under other circumstances. Please note that we are recording this briefing. We also have two caveats. The first is the pace of this situation is rapidly evolving, so the actual discussion that we're going to have today could actually change during the course of this call. And secondly, we are not offering a legal analysis on this call, meaning our PPG&Y staff. Others may opine on some of the legalities of the matter, but we are speaking as representatives of the Planned Parenthood of Greater New York Health Center and presenting a status of our service delivery and our advocacy efforts based on recent events. On Friday, a federal judge in Texas blocked the U.S. Food and Drug Administration, the FDA's approval of Misoprostol, threatening the 22-year approval of the medication. One of two medications used in the most common medication abortion regimen in the United States. However, the judge also stayed the decision to give the federal government 7 days to seek relief on appeal, which means that for now, approval of Misoprostol remains protected in New York. In a separate ruling, a federal judge in Washington issued a preliminary injunction in a Misoprostol case brought by 18 attorneys general. While a lot of this remains unclear, the two rulings between the two rulings right now, the approval of Misoprostol remains protected. This afternoon, you're going to hear from Planned Parenthood of Greater New York President of CEO Wendy Stark about the potential consequences of the decision, and Dr. Gabriela Aguilar about the safety and effectiveness of the medication abortion and how Planned Parenthood of Greater New York will continue care no matter what. We're also joined by Niharika Rao, co-founder and lead organizer at Reproductive Justice Collective New York, a grassroots youth-led advocacy group lobbying to secure medication abortion on college campuses. All the names, titles, and pronouns of our speakers are available to you in the chat. We're going to open the floor for Q&A following the remarks. We've got several electeds here with us as well. We're really excited to have here with us. Please hold your questions until after they speak. I'm going to hand the mic over to Wendy, President and CEO of Planned Parenthood of Greater New York.
Thank you, Deepal, and good afternoon, everyone. Once again, a hostile court has decided to shame and punish people for their pregnancy outcomes. And once again, medical professionals are being forced to overcome unprecedented challenges to provide compassionate care. This lawsuit is not about the FDA's process to approve a safe and effective medication. It is simply another cruel attempt to compromise abortion access through our broken court system. And this time it has hit close to home in New York, where abortion is safe, legal, and readily accessible. A Texas court has no business interfering with access to healthcare in New York, and abortion is healthcare. The court's egregious decision to rescind the FDA's approval of Misoprostol prohibits Planned Parenthood of Greater New York, along with healthcare providers across the country, from using Misoprostol for medication abortion, at least for now, because we know this fight is far from over. Let me be clear, this ban on Misoprostol does not end access to medication abortion. Planned Parenthood of Greater New York will continue to deliver on its commitment to care no matter what by offering our patients the full range of abortion options, including in-clinic abortion and medication abortion. If Misoprostol does get taken off the market due to this baseless lawsuit, we are prepared to use another safe and effective regimen. In a few minutes, you will hear from my colleague, Dr. Gabriela Aguilar, about the safety of medication abortion and about this misoprostol-only regimen, which is commonly used for medication abortion globally. While Planned Parenthood of Greater New York has positioned itself to continue uninterrupted patient access to medication abortion, we must also grapple with the far-reaching consequences this will have on people who are trying to navigate the complexities of this post-Roe world. The U.S. Supreme Court's dangerous decision to overturn Roe versus Wade has put abortion care out of reach for 1 in 3 women and many more transgender men and non-binary individuals. For the past 8 months, we at Planned Parenthood of Greater New York, along with our partners in healthcare and abortion access supporters, have been helping people from across the country connect to care in our state. We know that further abortion restrictions, like the ban on Misoprostol, will only compound existing racial, ethnic, and socioeconomic health inequities. This reaffirms why we must continue to intentionally center marginalized communities in our healthcare provision, education, outreach, and advocacy. We are so proud to be part of an ecosystem of healthcare providers, educators, advocates, elected officials, and supporters who are fighting for a more just and equitable future. Much like the Dobbs decision last summer, this news will and has already overwhelmed, confused, and heightened fear within the communities we serve. We want to send a loud and clear message to our patients. Abortion is healthcare, and it is still your legal right in New York State. Planned Parenthood of Greater New York will continue to offer you the full range of abortion options, whether it's in-clinic or medication abortion, because that is what you deserve. We need the support of our representatives. We must ensure a Medicaid reimbursement increase for sexual health services, including abortion. The fiscal year 24 budget must include the $25 million investment proposed by the governor to continue critical grant funds for abortion providers and those seeking care. And we must pass legislation to establish the Reproductive Freedom and Equity Program. Planned Parenthood will remain committed to doing whatever we can to ensure patients can access the abortion method of their choice with as few barriers as possible. Now I'd like to turn it over to Dr. Gabriela Aguilar, Medical Director at Planned Parenthood of Greater New York.
Good afternoon. My name is Dr. Gabriela Aguilar, and I'm a licensed, practicing, and proud sexual and reproductive health provider. And I can assure you that this court decision does not change the science. Patients trust us to provide them with the most advanced, evidence-based healthcare options available. The use of mifepristone is medical best practice, and it is used in nearly half of all medication abortions in the United States. Not only is mifepristone used to ease the experience and improve the effectiveness of medication abortion, it is also medical treatment for miscarriage. It is cruel to take away medical best practice from anyone seeking healthcare, but especially to those experiencing pregnancy loss. Forcing the FDA to withdraw approval for mifepristone physically punishes people for their pregnancy outcomes. This is especially true for marginalized communities that have long been denied life-saving healthcare. There's no denying that the alarming rate of Black maternal mortality is a symptom of inequality in healthcare access. When compared to their white peers, Black women are more likely to experience harm and mistreatment during pregnancy, and we can expect this to continue or worsen if mifepristone is removed from the market. Additionally, studies show that transmasculine and non-binary people are more likely to experience unintended pregnancy than their cisgender peers. Despite all of this, a Texas court reversed 20 years of advancements in medicine and decided on behalf of our patients that they do not deserve compassionate healthcare. This is dehumanizing. The FDA approved the use of mifepristone for abortion in 2000 and expanded its availability based on its medical safety and efficacy. The World Health Organization includes mifepristone and misoprostol on its list of essential and life-saving medicines. Medication abortion, with and without mifepristone, is safe and effective for virtually anyone who needs to end an early pregnancy. Planned Parenthood of Greater New York will continue to deliver on its commitment to care no matter what by offering our patients the full range of abortion options, including in-clinic procedural abortion and medication abortion. If we are forced to stop using mifepristone, we will immediately shift to a safe and effective misoprostol-only regimen. The misoprostol-only regimen is highly effective and meets Planned Parenthood's high-quality medical standards and guidelines. It is also common practice in many places across the world where mifepristone is inaccessible. Everyone should have the ability to make decisions about their own reproductive lives and futures, including choosing the method of abortion that works best for their circumstances. No judge, court, religious group, or political party should make that decision for them. Now I would like to offer a few words in Spanish. La decisión de la Corte en Texas no cambia la ciencia y el hecho de que la mifepristona es una opción segura y eficaz para el aborto y el tratamiento médico del aborto espontáneo. Es inconcebible que un juez que no es profesional de salud haya revocado 20 años de ciencia basada en evidencia como parte de una agenda antiaborto políticamente motivada. Planned Parenthood de Greater New York continuará cumpliendo con su compromiso de cuidado médico, pase lo que pase, ofreciendo a nuestros pacientes la gama completa de opciones de aborto, incluido el aborto en clínica y el aborto con medicamento, utilizando otro régimen seguro y eficaz. Todas las personas deberían tener la capacidad de tomar decisiones sobre su propia vida reproductiva y su futuro, incluyendo la elección del método de aborto que mejor se adapte a sus circunstancias. Now I'd like to introduce Niharika Rao, co-founder and lead organizer at Reproductive Justice Collective New York.
Thank you, Gabriella. Hello all. I speak today on behalf of the Reproductive Justice Collective of New York, a youth-led advocacy organization fighting for reproductive access for all young people in the state. We've been fighting for legislation that would mandate medication abortion pill access on campus across New York. And this decision further places barriers on students and young people who are struggling with the lack of access to basic form of essential healthcare. Young people like me already faced increased barriers to abortion care, including travel, distance, cost, and stigmatization. And medication abortion offers a private way to have an abortion. As an abortion doula, I've supported multiple young people in New York who've told me how grateful they are that they can have an abortion while in a dorm, while sitting in their class, while being supported by their friends, and while being able to engage with their familial responsibilities. Already, medication abortion care is exceptionalized in student primary care and insurance settings, and this decision further represents restrictions that are entirely politically motivated and not based in science. Like folks before me have mentioned, if Misoprostol is eventually removed from the market, my peers and I will be directly affected and our health choices placed in a perilous position. We expect New York universities and providers to provide clinical staff with training on the misoprostol-only regimen, as well as how to communicate to patients about the impact of the misoprostol-only protocol. We will not let this case deter us from demanding reproductive care for young people who continue to face these unique barriers to abortion care across New York.
Thank you, Niharika. Now I'm very excited to welcome Governor Kathy Hochul to speak to us. I also want to remind people that if they have a question, we need to save them for after the speakers, and please put them in the Q&A box with the name of your outlet. Thank you.
Well, thank you, Deepal, and I'm very honored to be here today. And thank you, Wendy, our president of Planned Parenthood, and your entire team that are working so hard on these issues. Delighted to see our incredible Attorney General, Tish James, who we're working so closely on this very issue with. We just got off the phone. I know that Assembly Member Jessica Gonzalez-Rojas has put her heart and soul into dealing with these basically a crisis right now as well. And great to see our Speaker, Adrienne Adams, as well. And I think we'll be joined by the mayor. But I want to thank, first of all, Planned Parenthood of Greater New York for everything you do, not just to protect the health and well-being across our state, but also the rights of our people. And when it comes to reproductive freedom in this country, we are right now facing historic, horrific setbacks. Just 1 year ago, women in this country had a constitutionally protected right to an abortion. And then in June, with the Dobbs decision, we are forced to confront a painful reality that the fundamental rights that my grandmother's generation had to fight for were stripped away with one decision. Now, the mega anti-abortion extremists, legislators and judges alike, are hell-bent on continuing down this path. They're coming after all forms of reproductive health care, and they took their latest step just on Friday with the ruling that'll further limit access to Misoprostol and for millions of women across this country. One judge in Amarillo, Texas, thinks he knows better than thousands of doctors and scientists and experts, and not to mention the countless women who've used this medication safely for decades. So this isn't just an attack on abortion, it's an attack on democracy. Courts have never before revoked a science-backed decision made by the FDA. And if this decision stands, it could have unprecedented consequences that reach far beyond abortion, threatening the FDA's critical role in our country's public health system. So, this moment calls for bold leadership at every level of government. And I'm glad the Biden administration came out so strong against this ruling, and we've been standing shoulder to shoulder with them. And at the state level here in New York, we're not going to let one extremist judge turn back the clock on more than 20 years of safe, reproductive care. New York has always been at the forefront of this fight. In the wake of the Dobbs decision, we allocated $35 million to reproductive health care providers. We mandated all insurance companies doing business in New York cover abortion. And I signed a package of legislation protecting providers and our patients. And last year, the attacks were on abortion procedures. This year, medication abortion. What's next? Contraception? Birth control? Well, I'm here to say, not in New York, not now, not ever. So last year, we called an extraordinary legislative session. We took one step closer to passing New York's Equal Rights Amendment. The ERA, as written, will enshrine abortion and contraception rights and protect all forms of reproductive health care in our state constitution. The ERA and these fundamental rights will be on the ballot next year. Once again, states have become the battleground on these fights. And one latest steps to tear down these rights have only strengthened our resolve. So I'm proud to announce that New York State will create a stockpile of Misoprostol, another form of medication abortion. Extremist judges have made it clear that they won't stop at any one particular drug or service. So we're going to ensure that New Yorkers will continue to have access to medication abortion no matter what. We're also announcing that if this decision stands by this judge, we will dedicate up to $20 million more for reproductive health care providers beyond our current $35 million to support methods of access to other forms of care, including procedures. And we're in conversations with the legislature right now about requiring private insurance to cover medication abortion as well when it's prescribed off-label. All this is in addition to actions we laid out in my proposed 2024 budget, which increases the Medicaid reimbursement rights for reproductive health services, provides more funding for providers, and allows pharmacists to prescribe birth control, as well as implementing data privacy protections and expanding abortion access on SUNY and CUNY campuses. We'll always protect access to reproductive health care and all individual rights here in New York. It's part of our legacy. And in fact, abortion was legal here in New York 3 years before Roe v. Wade was even decided. So as long as I'm governor, New Yorkers will have access to the care they need when they need it. And we'll continue to open our arms to all people seeking freedoms and autonomy. And it's important that we're still fighting this fight yet again. But here we are with all of you, our partners, suiting up for battle in partnership. Let's continue and let's win this fight. Thank you, everyone.
Thank you so much, Governor. Next, I'd like to welcome terrific champion of reproductive rights, Attorney General Tish James, to speak.
Thank you so much for that introduction. I want to thank the governor for announcing the stockpiling of Misoprostol. I really appreciate her and her agenda for protecting reproductive rights in the state of New York. To Wendy Stark, to Dr. Gabriel Aguilar, and to all of the partners at Planned Parenthood of Greater New York, and of course to the mayor of the city of New York, Mayor Eric Adams. I thank all of you for your work and leadership in the fight for reproductive rights. So once again, we find ourselves defending ourselves against an all-out attack on reproductive freedom from a far-right judge who substituted his conservative judgment for 20 years of research and science. Again, this is not a debate about science, because more than 20 years of medical research has proven that medication abortion is safe and effective. This is a politicized effort to control our bodies, to deny reproductive health care nationwide, and to chip away at our rights. Medication abortion is critical to reproductive health care, particularly for those living in low-income, underserved, and rural communities, and for women of color. Safeguarding access to medication abortion is a top priority for my office. And that means that for now, approval of Misoprostol remains protected, and abortion remains protected in the state of New York. As of Friday night, as you know, the Biden administration has already filed its notice of intent to appeal this decision. And yesterday, I led a multi-state coalition of 24 attorneys general to fight back against this harmful, destructive decision. we filed an amicus brief urging the United States Court of Appeals to stay pending appeal the district court's ruling. We also have established a task force, a reproductive justice task force, with 40 of the largest law firms in this nation to assist providers and individuals seeking access and with legal questions. You can reach that task force at 212-899-5567. Abortion care is and will continue to be legal in New York. In New York, we respect a woman's right, a person's right to choose. In New York, we will not be bullied by right-wing ideologues. In New York, we recognize that abortion care is health care, period. Every abortion clinic and provider in the state of New York has the full support and weight of my office behind it. And we are actively working with our partners in government to figure out our next steps in the fight in the face of this decision. But we will not rest until every person in this country has the right to choose what they do with their body. And I will continue to do everything in my power to ensure that access to abortion, including medication abortion, remains available and protected in New York. And I look forward to continuing to partner with all of you in these efforts. Thank you.
Thank you so much, Attorney General James. Abortion care is health care. We stand by that. Next, I'm delighted to welcome Mayor Adams to speak.
Thank you so much. And I really want to applaud our Attorney General for her swift action in mobilizing all those who stand on the side of what's right across this country. And the governor has made it clear here in New York that we will be a safe haven for those who are fleeing unfair abortion rulings that's coming from every level of Trump-appointed judges, particularly this one. Last Friday, a Trump-appointed judge in Texas set on trampling the law instead of upholding it, made the decision to strip away a freedom that American women have had for decades, effectively making the most commonly used medication, abortion drug, illegal across the nation. The decision by Texas court is another assault on women's rights and a setback for this entire country. For more than 20 years, the drug has been one of the simplest, quickest, and most common options for women managing an abortion or miscarriage in the United States. Right now, at least 29% of all women of reproductive age in the US are already living in states where surgical abortions are virtually unavailable. And banning this safe and effective drug would effectively reduce medication abortion options for approximately 40 million women nationwide. New York City supports the federal government's legal effort to reverse this harmful decision and to restore the authority that the FDA should have under the law. Today, with other cities and countries, we are leading the filing of an amicus brief that highlights the negative impact this ruling will have on our public hospitals and the people who rely on them for care. If the safe and effective two-drug regimen is suddenly removed, our public healthcare system will have to divert resources to provide alternate options and procedures. This will put a strain on public hospitals' already limited resources. It will affect public hospitals' abilities to provide care to patients seeking abortions and could impact their ability to provide care across the board. It will make providing health care to already vulnerable New Yorkers even more difficult. Our public hospital system will always be open to the patients who need care. Yet, this decision will make delivering care that much harder. Friday's decision was about one thing and one thing only: controlling women's bodies, their choices, and their freedom. We have already seen the Supreme Court issue a ruling taking us 50 years back in time with the overturning Roe versus Wade. And the Texas court ruling is yet another extremist decision that would affect millions seeking health care across the country, including those here in New York City. You have my word as mayor, the largest city in America. We will do everything in our power legally, personally, and politically to fight this ruling and defend the rights of women. New York City is and will remain a hub for reproductive health care for all women. Both our Department of Health and our public hospital system will do everything they can to provide support and access to all women in need of reproductive health. Should this ruling go into effect this week, New York City's public hospital system and its health department will continue to make medication abortion accessible to all by shifting to a different treatment regimen that will comply with the law. But here in New York City, the birthplace of the women's rights movement, a city where Eleanor Roosevelt, Shirley Chisholm, and Gloria Steinhardt blazed a new path for women in America, we will never let these freedoms be taken away, especially the right to live life on your own terms without conservative judges deciding what's best for you. Thank you for this fight, and let's continue to fight together.
Thank you so much, Mayor Adams, for being in this fight with us. Next, I'm welcoming Speaker of the New York City Council, Speaker Adams, to speak.
Thank you so much. And I just have to give a tremendous thanks to all of our partners at Planned Parenthood of Greater New York for convening us here today to discuss an issue none of us want to talk about, but we won't. We simply won't let it go unchecked. I'm so proud to be the council speaker, and I'm proud to lead the first women council in our city's history. You know, last Friday's unprecedented ruling to invalidate the FDA's approval of Misoprostol was an outright attack, not only on our reproductive rights, but on the practice of medicine overall. It was a dangerous act of political theater. There's no medical, scientific, or evidence-based reason to justify the judge's ruling. In fact, Misoprostol has provided over 5 million people with safe and effective access to abortion care for over 20 years. Let me take this opportunity to make it very, very clear. Misoprostol is highly safe and effective, and it remains available to anyone who needs it in New York City. With many thanks to our Attorney General, our governor, and our mayor. That is an important set of facts the media must provide to the public in this very moment. Last year, our Women Majority Council enacted the historic New York City Abortion Rights Act, including legislation by Councilmember Carlina Rivera to require all Department of Health and Mental Hygiene clinics to provide free abortion medication. As a result of the council's efforts, access to abortion medication is now law. Any New Yorker in need of Misoprostol should not hesitate to secure it, and it is currently available at DOHMH's Morrisania Sexual Health Clinic in the Bronx. Misoprostol is also available at the city's health and hospital public health hospitals and private clinics across our city. Additionally, the council committed $1 million last year, the largest commitment of municipal funds by any city in the country, to expand access to abortion care for those who need financial aid to afford this vital health care. With these supports, we sent a clear message that New York is a safe harbor for anyone seeking reproductive health care. We will not stand silent as reckless and baseless decisions that threaten the health of millions of women and birthing people across our city and across our country occur. We will unite as we have today, and we will fight, standing together in defense of our fundamental rights and putting the health of our people first. The council will continue to safeguard and expand access to abortion and reproductive health care so that everyone has the right to self-determination and can make the best decisions for themselves. And on a personal note, Easter holidays spent with my relatives, watching generations, from the eldest to the youngest, my 22-year-old niece, my 8-year-old granddaughter, just to think that a 22-year-old and a 9-year-old may not possibly have the same freedom in our country as I have had, her grandmother and her aunt have had in this country, the greatest country on the planet. It's unacceptable to me as a leader in the greatest city on the planet. We will continue to fight, all of us, to secure the rights for reproductive health care in our city and our nation. Thank you very much.
Thank you so much, Speaker Adams. And finally, last but certainly not least, one of our greatest champions, I'm happy to invite Jessica Gonzalez Rojas, Assembly Member for New York's 34th District, to speak.
Thank you all for having us. Thank you to Planned Parenthood, Greater New York, and our partnership with the Empire State Votes team. I have been working alongside so many of you and other reproductive rights and justice organizations like Girls for Gender Equity and the National Latina Institute for Reproductive Justice, which I used to run for 13 years. This is near and dear to my heart. Groups like NAPOF New York, ACLU, Jahaji Sisters, All Above All. We have been working together to fight the attacks on reproductive justice over the last couple of years. So like many, I was not surprised by this ruling. This was decided by a Trump-appointed judge in Texas. This medication abortion has been effective and utilized over the last 22 years. I am continuously enraged by the attacks across our country on our bodily autonomy. As these right-wing assaults on reproductive justice continues, so must our resistance to them. The reproductive justice movement that I've long been part of knows well that Misoprostol has been part of an effective regimen for abortion medication. As was mentioned, it's been used by millions of people and has been proven to be very safe and effective according to decades of robust scientific research. This is not about public health. This is not about public health. This is about power and control and the conservative movement's obsession with restricting our ability to determine if, when, and how to create a family. So while we've made advances in our fight for reproductive justice in New York State, we cannot stop at ensuring just the right to an abortion, right? We know that right to an abortion without access to the right is no right at all. We must invest in legislation that puts state dollars towards ensuring that every single New Yorker has access to abortion as well. So with the likelihood of this ruling will stand in higher court, hopefully not, because I know we've been fighting this tooth and nail, we have to be proactive. So I'm thrilled to have launched the Reproductive Freedom and Equity Fund Act, actually alongside our Attorney General last year in the wake of the Supreme Court ruling. I'm urging our state legislature and our governor to pass and sign the Reproductive Freedom and Equity Act, which, by the way, is A361A, which will ensure that every New Yorker has the access and ability to determine if, when, and how to create a family by getting the money and resources to facilitate and access abortion care here in New York. Whether you live in rural parts of New York, whether you live in the Bronx or Queens, or whether you live outside the state, we want to ensure that we have the practical support to get folks the care that they need. So I'm here to say that we're going to continue to fight, and we will continue to fight to ensure that we have reproductive justice for all. So thank you for your partnership. Thank you for your work. And I'm in it with you every step of the way.
Thank you so much, Assembly Member. And I want to thank all of our electeds who are here with us today for being with us in this fight, for being tremendous partners to us during this pivotal moment. We need you more than ever right now, and we appreciate you being with us.